sacrifice, another huge sacrifice. Teachers and pupils coping with online learning, businesses who have borne the brunt of successive lockdowns, and of course the amazing staff of our NHS and our care workers who are grappling with this new variant of coronavirus. And I believe that when everybody looks at the position, people understand overwhelmingly that we have no choice. When the Office of National Statistics is telling us that more than 2% of the population is now infected, that's over 1 million people in England, and when today we've reported another 60,000 new cases, and when the number of patients in hospitals in England is now 40% higher than at the first peak in April. I think, obviously, everybody, you all, want to be sure that we in government are now using every second of this lockdown to put that invisible shield around the elderly and the vulnerable in the form of vaccination, and so to begin to bring this crisis to an end. And I can tell you that this afternoon, with Pfizer and Oxford AstraZeneca combined, as of this afternoon, we've now vaccinated over 1.1 million people in England and over 1.3 million across the UK. And that includes more than 650,000 people over 80, which is 23% of all the over 80s in England. And that means that nearly 1 in 4 of one of the most vulnerable groups will have in 2 to 3 weeks, all of them, a significant degree of immunity. And when you consider that the average age of COVID fatalities is in the 80s, you can see the importance of what we have already achieved. And that's why I believe that the Joint Committee on Vaccination and Immunisation was right to draw up a programme aimed at saving the most lives the fastest. So by February the 15th, as I said last night, the NHS is committed to offering a vaccination to everyone in the top 4 priority groups, including older care home residents and staff, everyone over 70, all frontline NHS and care staff, and all those who are clinically extremely vulnerable. And to help us with meeting this target, we've already have 595 GP-led sites providing vaccines, with a further 180 coming on stream later this week. We have 107 hospital sites, with a further 100 later this week. So that's almost 1,000 sites, vaccination sites, across the country by the end of this week. And next week we will also have 7 vaccination centres opening in places such as sports stadium and exhibition centres. We know that there will still be long weeks ahead in which we must persevere with these restrictions, but I want to give you, the British people, the maximum possible transparency about this vaccine rollout, with more detail on Thursday and daily updates from Monday, so that you can see day by day and jab by jab how much progress we are making. Thanks very much. I'm now going to hand over to Chris to do the slides.
Thank you, Prime Minister. First slide, please. Just some updates in terms of data. In the 2 weeks from the 30th of December to the 30th of December, the UK case rate increased by 70%. And as you can see from these 2 graphs, one of which is from the middle of December on the left, and one on the right, the map, is from the 30th of December. The darker colours are areas where there are very high rates of transmission. And as you can see across the whole of the UK, there has been a steady increase in the rates. Next slide, please. These are the most recent data from ONS, the Office for National Statistics. What this shows is the number of people, and they do this on a random sampling basis, so this is a good estimate of the general population. And this shows the data from August, when we actually had very low rates. So in the middle of September, for example, 1 in 900 people had rates. Then an increase, the lockdown was brought in, and that brought down the rates. But then we had the problems of the new variant, which I'll come on to in the next slide, and the worst period of winter combining to lead to a significant increase since that time. And we're now into a situation where across the country as a whole, roughly 1 in 50 people have got the virus, higher in some parts of the country, lower in others. But 1 in 50 is really quite a very large number indeed. Next slide, please. If we look around England, what we find is that in every area, there has been a relative increase in the new variant of this virus that is spreading around the country. Fastest increase in the east of England, London and the southeast, but it is now taking off in other areas as well. In some of the areas where it took off to the highest level, and Tier 4 was brought in during a period when schools were closed, there may be some early indications of some levelling off, but I think we shouldn't overinterpret that. But it is really clear that this new variant has been rising in all parts of the country, and what we've seen is that the bits of the country which have got some of the lower rates and had previously controlled things, particularly in the northeast and northwest, for example, the rate of increase has, in many of these, been higher than in some of the southern areas, which have got very high rates already. Next slide, please. And this is inevitably translated into new numbers of patients going into hospital. So these are the number of people in hospital all the way from the 1st of April through to the 1st of January. And you can see the first peak of people in hospital then decreased due to the remarkable efforts of everyone in the country during the first lockdown and then through the summer months. An increase which then again went down due to the second lockdown, but now really a very rapid increase, and I don't think you need any modelling to see in what direction the number of hospitalised patients with COVID is going, and this is going up very rapidly, and of course we are still in the middle of winter. Next slide, please. And sadly, of course, some of those people go on to die. This is the number of deaths of people who had a positive test result, and there was an increase which led to the second lockdown, a decrease following that, but these numbers of deaths are now increasing again. They are, at this point, quite a long way below the first peak, and there are 3 reasons for that. The first of which is very good news, is that doctors, nurses, medical staff in general are able to manage this disease better than they did previously. Better drugs, things like dexamethasone, but also better treatment all round. The second reason is that there is an age effect, that some of the people who are being infected at the moment are younger age than in the first wave, but this obviously, what we've seen previously, is it moves up through the age bands over time. But the third reason is that deaths are much delayed. So what happens is people get infected, there's then a delay before they get ill enough to go into hospital, and then there's quite a long delay before some people sadly die. And we will unfortunately see, because of the spike in people going into hospital from the last slide, we will inevitably see an increase in number of people with